Hello, this is Robert Rickover, and my guest today is Eileen Troberman, an Alexander Technique teacher in the San Diego area. I teach in Lincoln, Nebraska, and Toronto, Canada. And we're doing a series of sessions in which Eileen is basically showing me, teaching me some ways in which I can more effectively use myself in various activities, given that I've had recently spinal fusion in my neck, from C3 to T2. So that does very much affect stuff up here, but just generally in my body. And we've done a few other things, and we're going to talk today about bending. And Eileen, take it away. I'm ready.
So what I'd like you to do first is to get up and go over to that kind of vase thing on the wall just in front of the picture of Marge, and just bend and touch the upper edge of that rack for the walking sticks.
It's from Mexico, by the way.
Oh, so go all the way over to Mexico there and
just touch the upper
border
edge and come back and come back.
Yes.
Okay.
Yes. It'll be a nice vacation.
Yes. Better than just a vacation.
Yeah.
Could you see that?
Yes. What did you know? Did you notice anything about your bending?
Well, I did bend at my hips and knees, I thought. It didn't seem, it was a small bend.
Yes.
But I didn't see it, so.
Yeah. So what is happening a little bit in your bending? Mm-hmm. And particularly even when you're walking and looking down,
mm-hmm.
What's happening is you're bending a little bit from the bottom of the fusion. So right around the T2, T3 area.
Oh, okay.
So that's why I wanted to talk to you about bending. And yes, you do bend from your hips, knees, and ankles. Yes, you use the top vertebra, but
mm-hmm.
There's also going to be a way that I'd like you to, it's kind of a silly thing at first, and we'll just experiment with it. But I think that will help you when you bend, not drop over in this upper part here. So what I saw you doing is in your bend, when you went to bend, or when you're looking down as you're going over, see how I'm bending from
Yep, I see that.
Can you see it?
Yeah. From pretty much that area, yeah.
Yeah, so I'm kind of bending from there without realizing it, and it'll feel kind of easy. It'll feel like, well, that's all right. I'm just easily looking over. But in fact, especially with the fusion, you have to be careful of that. So when you bent, then you had this, and then you were bending, but that was getting a little extra pressure over there and supporting a lot of the weight of your head and neck at that point from where the fusion ends and your freedom of the joints begin. And it's so important to not get a stress in that area because it can irritate that joint. So what I would like you to do, and this is going to seem a little silly, but actually let me just show you this on Fred here, my assistant. So when Fred bends, so say Fred wants to look down there. So he's got that top joint, which you know of, and yours is actually, it's gotten pretty free up there. You know, you're using the freedom you have in that top joint and the next joint well. So yeah, you can tip that, look down, but he's not going to be able to see really right down there in front of him. He can kind of see over that way. He can see a certain degree, but if he wants to see more right over close to him, his hips and knees and ankles have to bend with that. So when they bend, can you notice, if you were going to describe what direction the bottom of his hip bones went in, the thing we often call the sits bones, little ischiotuberosities here on the bottom. Right. If he bends, describe to me what direction those go in.
I would say back in space.
Yes, they do go back in space, they don't just go back like this in space. See, that's different than this. See how they almost go back and up? They almost make like a 6 of a circle.
Oh, I see. Okay. Oh, backing up. There is a bit of a backing up aspect to it.
Yeah.
Okay.
It's
All
just
right.
rotating around the hinge of his hip joint,
Right.
but they
Right.
stick out behind his hips.
Right.
Look at those sits bones sticking out there. I mean, really, they
Mm-hmm.
stick out a lot behind the hip joint, just because the
Mm-hmm.
hip joint's higher than that.
Mm-hmm.
And so a lot of times when we bend, we don't we don't allow those to sort of stick out. And then we get more bend up here.
Well, wouldn't we get that back and up more if we also made sure we bent our knees and ankles?
Absolutely, that's part of it, the knees and ankles. But it
Mm-hmm.
doesn't necessarily mean you'll get that little backing up. That backing up feels kind of funny to people. Now it isn't at all shortening in your spine, because if he was really kind of sticking his butt out, he would be shortening here.
Right. Right.
It's just he's completely neutral. But yet when he bends, they start lengthening out behind him and rotating almost a little. They'll feel like they rotate a little up the bottom of our hip bones. And we're very sensitive to the movement here. And so most of us don't really quite let that happen so much. And then we have to make it up by a little more bend in our upper thoracic. So
So, and when you say bottom of our hip bones, you mean the sits bones, the bottom of our
yes, the
pelvis,
ischial
basically?
tuberosity,
Right.
the thing that sticks out the furthest to the left here in this
Right.
picture of the skeleton. Yeah,
Right.
yeah,
And the part of our pelvis that actually is designed to bear our weight when we're sitting, which is
absolutely.
a topic which is extremely important to know about for other reasons. But so
Yeah, well,
are you suggesting that when I go over to touch Mexico again, that I actually direct my sits bones backing up in space?
yes, not
That
trying to
sounds
do
like
anything
what
with
you're,
them, but just letting them be something that sticks out behind you. You don't even need to think of them necessarily going up, but you really think that they are going to stick out further than your legs.
okay,
So it's not, you're not going to try and like pick them up in a
right,
funny way, but
right.
you're just going to let them stick out a little further than your legs, so that when you go to bend,
Mm-hmm.
when you go to bend to touch that nice base there,
Mm-hmm.
if you can look down here, but maybe you don't see down as close as you want, so your hips, knees, and ankles bend. But when they do, if this goes back like this, if I
You
use
don't
my fingers, you can
compromise
see.
your spine. You don't compromise the,
No, and in fact,
yeah,
it really supports my center of gravity, like about really well, the center of mass, center of gravity. I'm not sure you know the right terms for this, but
they're
it
more or
lets
less
that be more over
synonymous.
my
Yeah.
feet than it
Yeah.
does if I do this. That makes the
Mm-hmm.
center of gravity too far forward and puts strain on my knees. If that goes back, that really lets that center be over the center of my feet. So yeah, I'd like you to just give that a little try as you go over there.
So
And
what I
that's,
will think about is um, allowing my sits bones to go back and up.
yes, yeah. So you actually just have more length between your head and your sits bones, but you don't need to feel anything particular with it.
Oh, certainly
Just
not.
when you
We're,
want to look down, see if you can look down by an easy release of the sits bones.
ooh, that's good. I'm going to give that a try.
Better. Let's do it. Stay there for a moment. Don't sit
Okay.
yet. And
Yeah.
now as you're going to go over, and even as you go over and turn from here and just look from where you
Mm-hmm.
are at that
Mm-hmm.
vase there,
Mm-hmm.
see if when you look at it, you're
Right.
not aiming your head to it.
Ah, okay.
So, yeah, so just stay there for a moment. Don't go over to it yet, Robert. Can you just come back?
I'm
Yeah,
too eager.
and well, we'll have lots of opportunities to go over there. So just turn away from me and just take what, actually just turn away from me where you are and face the vase.
Okay.
And now as you're looking at the vase, you
Mhm.
can do your Alexander directions, whichever way you let. Yes, there you
Mhm.
go. And now
Mhm.
if you want to see further down, your hips just go a little bit back. Yeah. Yeah, and your knees and ankles just accommodate that and bend. But you continue to just, you can actually have your hips go back to where you actually are facing, looking down at that as you walk over there, or as you get over there and you're going to bend. So as you walk over there, go ahead and walk over there easily, however you
Right.
want to do with your
Right.
the
Mhm.
ease of the length of your torso. And
Mhm.
yeah. And now you could actually, without reaching down first, if you
Mhm.
come back to just your ease and your length and
Mhm. Mhm.
noticing ease, you can just from there, without even looking down necessarily, if your hips went back, your sits bones went back,
Mhm.
and your knees and yes, there you go. Yeah, and the more your arm reaches forward to balance your center of mass with that reach, the more the
The
sits bones
more
go
the
back
sits
to
bones go
balance.
back.
Yes.
Okay. So it's kind of, it's almost, I mean, usually Alexander people talk about the head leading and the body following, even the eyes leading the head and the head leading the body kind of stuff.
Yes. Yeah.
And you're saying, well, yes, but maybe in this case, it might be your sits bones leading this particular movement.
Maybe leading that movement, but what leads the use of yourself for any movement? It takes the pressure off.
The internal
That
direction,
freedom in your
internal
neck and the
stuff,
balance of
yeah.
your head
But
being easy and your whole torso lengthening and widening. So as you're doing that, that's still happening. But then there's
right,
other movements that we do. And
right.
in those movements, there is, as that the Alexander directions are primary, then
Mhm.
there is the movement of bending by the hip bones going back that lets you
So
bend on your
the
sits
big,
bones. And
we talk about in classic Alexander version of what to do with your head and neck is, my neck to be free so my head can move forward and up. It's not a direction I personally care for anymore, but that those are
mhm.
all sort of internal or yeah, I would say internal directions. And this direction of sits bones going back and up in space, that's an external movement, you might say, right? Or a movement in space as
Yes,
opposed,
exactly. Yeah, so if I
yeah.
bend my arm, it's those joints moving.
But you're
They
not
move much better if this all is
right,
free and expands, and there's that moment of just thinking, wait, I can do this differently. That moment of just that little shift that in traditional Alexander is called inhibition. Thinking, wait, no, I don't need to do it the way I usually do. I'll
right,
rethink this. Yeah.
right.
So there's
So
other joints, like
we're
you
not
said.
overthrowing primary control here for those who are might be foaming at the mouth. That the primary control is still extremely important, but it's important as you make certain movements of your body, and in this case, it's a movement back and up a little bit of your sits bones in
Yeah,
order
so you
to,
really are then bending very freely at the hip joint.
Mhm.
Otherwise, we cancel out some of that freedom at the hip joint. We stop bending a little early there.
Mhm.
So if when Fred bends, he starts maybe like this, but then he's like, okay, well, I'm not going to let them move anymore. See how that
Mhm.
stops some of that freedom at the hip
Right,
joint?
right,
And then what happens, and a lot of people get this just, without the fusion, they end up, because if this doesn't bend more, the
right.
next place we bend is right in the middle of our thoracic spine.
I
So
gotta
just even,
say, I think a place where this could really come in handy is getting into a car.
yes, yeah. So when you have to duck your head,
You gotta
yeah.
contort yourself perhaps a little bit to get in, you're twisting and so on. This might be a really nice um, process to bear in mind.
And actually, even in sitting, even as you're sitting too. And we can talk about that another time and how to use that
Okay.
with this. But I've actually, it's interesting. I found that so many people uh, can sense their sits bones moving
Mm-hmm.
so much that they think that even doing this, their butt's sticking out.
Mm-hmm.
You know, they just feel their sits bones behind their leg and going further behind their leg, and they think, oh, that can't be good. And it's funny, it's just something in a lot of us that we're kind of afraid of our butts sticking out or something. And
I've
again, it's
never
not
had
your
that
bottom
fear.
sticking out because that would be shortening in your spine.
Right. I've
It's
never
just
had that fear, Eileen. I just want you
good.
to know. It's not been an issue for me, but so that's
Yeah,
good. You think we
yeah,
should end there? This
yeah.
this was excellent. So I'm gonna